Hi guys, welcome back to the show. Time now to talk about cervical cancer on Lifestyle Daily this morning. And joining me this morning is somebody I'm curious to know personally. Why? Because a little bird whispered to me that she was the official medical director who was helping Ifya Sentua put her health in check during the singathon. Ingesanka, that's my friend Kaput. And so I'd like to take a minute and then ask her experiences and all of that. But shortly we'll delve into cervical cancer. I'm talking this morning to Dr. Grace Bakma, and she is medical director, Sunotok Medical Center. Did I get the medical name correct?
Sonotek.
Sonotek. It's good to see you. Happy New Year.
Many happy returns. Thank you so much for having me here.
Thank you so much for making time. How was the experience for you? Were you not tired yourself?
So I remember before the whole thing started, if I was like, we are doing this together.
Right.
Yes. And I mean, I had given her my word that we're going to put together a very solid team to make sure she goes through. So I felt it as a personal responsibility to make sure she was fine. It was a good experience.
Right.
The stress, myself, I lost my voice on I think the third day. It was a good experience, and I'm really glad she was able to do it. What she did wasn't even just the medical aspect that I was interested in, but as a woman as well. It's, told me that whatever we put our minds to do, we could get it done.
Beautiful.
So yeah,
Good
told her that was my motivation for this year actually.
Yeah. Right, that's beautiful. I'm drawing some motivation from you as well. Good job. Now let's talk about cervical cancer, and maybe before we get into that conversation, the conversation about cervical cancer started a while ago with the awareness, education, and all of that. As a medical doctor, have you seen any improvement with the number of women that come to the hospital, want to do early tests, whatever they need to know? Have we seen any improvements in it?
Okay, so thank you again. I mean, you are right. Cervical cancer, this is not the first time we're talking about it. And globally, January is set aside to draw attention to it. And in January, a lot of organizations, a lot of hospitals, a lot of facilities team up to encourage more women to get screened. Personally, I would say that the number of people coming to get screened, there's been some improvement, but definitely it's not what we want to see. When you look at the data, currently globally we are seeing about 600,000 women diagnosed every year, and out of that, more than 50% are dying. And the picture is no different right here in Ghana. We're having about 2,700 cases every year as at 2020 data. And then again, we have 50% of them, more than 50% dying. So it tells us that although we are seeing a lot of cases, being diagnosed, unfortunately, like most of the other cancers we talk about, people are being diagnosed at a late stage.
Okay.
And that's really the problem. And for most of the other cancers, including cervical cancer, once you are diagnosed early, it makes a whole difference in your treatment as well. So people come in late and not much is done, and then we lose a lot of them. For me personally, it's heartbreaking because we'll get to know that cervical cancer is one of the cancers that at least we can prevent.
Right.
Yes.
Right.
Yes. I mean, we can prevent.
Right.
There are a number of other cancers that we know that there's not much that can be
do.
Yes. But when it comes to cervical cancer, I mean, it's a vaccine, so why are we still having...
That's actually refreshing, because when you think about cancer, then people say that it's called the angel of death because you don't know, we just don't know where it comes from. But for cervical cancer, at least there's hope. That's nice. Now let's understand what's happening to a woman's body when I come to Dr. Bachman and she says that, I'm sorry, what I've been picking up, it looks like we're diagnosing you of cervical cancer. What's happening to me?
Okay.
I did have one.
So even before we get to that point of seeing that you have cervical cancer, there are a number of things that would go through before we get to that point of seeing that you are diagnosed. Definitely when you come, a history will be taken, you'll be examined. Probably you came with a complaint. So all those things will be listened well, and then you'll be fully examined. After that, some screening tests will be done, including your pap smear, which I'm sure we'll come to later on. And then probably your HPV, and then we'll do like a biopsy. It is only at that point where we can conclude that definitely there is cervical cancer, because that's when we are taking part of the cells to the lab and looking at it to see the changes to confirm that you have cervical cancer. And then once you have cervical cancer, it's a whole different ball game, because most of the times it will start at your cervix, where There are changes in the cells that we see there. So once it starts at the cervix, then it progresses. So as you are diagnosed, we need to determine the stage that you are in as well. Generally, we talk about 4 stages. There's a stage 1, 2, 3, 4. The stages give us an idea of how the disease has progressed in your body. So for instance, if after all the investigations we say that probably you are an early stage disease or a stage 1, maybe it's just the changes are just located at your cervix. You know, even when it's very early, we might not see it with our eyes. We might have to use a microscope to see it. That's very, very early, and prognosis is very good. Okay. However, when it progresses, then it's attacking some of the other structures close to the cervix. The closest you can think about is the pelvic wall. Okay. You can think about your vagina. Okay. You can think about your bladder. You can think about your rectum. So as the cancerous process goes on, it affects all these things. And even in advanced stages, it can spread to your liver, your lungs, even to the bones. So that is what will be happening in your body. And we'll need to confirm the stage of the disease that you are in. Okay. And then we can discuss what your treatment options are.
Okay.
Yes.
Okay, and so when a woman gets to know the stage, before we even go to the causes, the symptoms and all of that, it means that what she can't give birth, apart from what we know, you can die if it's not treated well. What's happening to you? You can have a child?
So it's quite dicey. There are a number of things happening down there, so we can't say automatically that you cannot or you cannot, because it's just at the cervix, remember. Someone can be pregnant and actually have cervical cancer. Okay. Because if it's an early stage disease, it's just focused. So as you can see on the screen, it's just that tip, like that's the end of the womb, the narrow parts or the top part of your vagina. And you know that once you're pregnant, your baby is mostly in the body, that big space there. Yeah. And if it's very, very early stage cervical cancer, we're hoping that it's just concentrated simply at the cervical region. So yes, it's possible.
What really causes it?
Okay, so fortunately, again, I say cervical cancer is not too scary because we know exactly about 95% of the cases of cervical cancer is caused by the human papillomavirus infection. So the human papillomavirus is an STI, it's a sexually transmitted infection. A lot of people have it. In fact, a lot of people have it. It's one of the commonest sexually transmitted infections that we see.
You don't say?
Yes, but the good news is that most of us will be able to get rid of it from our bodies, especially if our immune systems are good. Okay. So a lot of people get it without even knowing. You get it, your body has a way of handling it, and then you get rid of it. However, there are few people that the infection stays on, is persistent over a long period of time in your system without you knowing it. And then it's just a matter of years, it can develop into cervical cancer. So about 95% of the cervical cancer cases are due to persistent HPV infection. And for HPV2, there are a number of strains. When we say you have an HPV infection, you can have several strains, about 100 plus. However, it's the 16 and 18 strains that causes cervical cancer. Okay. So aside HPV causing cervical cancer, there are a few other things. In the early 90s, there were some women who were given some medication called DES, diethyl stilbestrol. So it's been found that daughters of those women, in the long run, most of them would have cervical cancer. But that's like, you know, the percentage is really small. And then the other group, smoking generally increases your risk for a lot of cancers, not just cervical cancer. And then the other things will still be related to the HPV infection. So for instance, if you are having sex early onset, sexual activity.
What does early mean?
At least relative, right?
Is it when you're 10? Or should we use what the maturity age of the Constitution says, 18? So pre-18 will be?
Probably. Probably, because once there is sex, then the possibility of having the infection is high.
Okay, let's stay on that.
Okay.
Will the early sex mean that we're assuming because you've started early, you're going to be exposed to a lot of sexual partners, or it's because you're young and your immune system is not strong enough to fight
No,
the HPV virus?
it's not about the immune system. It's
Okay.
about the longevity. So,
Okay.
yeah, I mean, once you started early, it means in your lifetime, you're going to be probably changing more partners.
Right.
And then the other thing is multiple sexual partners. So, not just you, even if you have one sexual partner, we're hoping that your partner would also not have multiple sexual
True.
partners, because then your risk is also high of getting the HPV infection. So generally, those are the...
If the HPV is a sexually transmitted, shall I say, virus, why is it concentrated in women only? Can we find the...
It's not in women only.
Good.
It's in men. So, so the HPV, and so now one of the discussions coming up is we should vaccinate the men as well, because it doesn't cause only cervical cancer. It causes other types of cancer, even penile cancer, and that's of course in men.
Penile cancer? You mean the cancer that affects the penis?
Yes.
So you cut off the penis?
You don't cut off the penis.
Okay, but it can be treated depending on the type of cancer that is affected.
Yes. So the HPV is not just about cervical cancer, penile cancer, vulval cancer, even genital warts. Yes, HPV causes genital, and even some throat cancers as well. So HPV is not just a woman-only disease; it's both women and men.
If you're a woman and you come into contact with the HPV virus, how long would it take for you to start seeing any symptoms so that we can get into the symptoms? How long would it take?
So then again, everyone is different. I wish we could say it will probably take 10 years, but generally it can take us up to about 15 to 20 years. And that's also, in a way, a good thing again with cervical cancer. Because during that long period or grace period, it gives you, if you get tested and it's picked up, you can be treated and then it will not progress into cervical cancer. So you see, for cervical cancer, there are so many good things about it, so many things that can be done to stop us from seeing all these deaths that we're seeing. So it depends on, first of all, your immune system. For instance, someone who has a co-infection, for instance, HIV, AIDS, or another infection, the progression will be faster. It can probably be like 5 years or less. So
why? Because their immune system is compromised.
It's compromised, yes. So it depends, but generally it's more than 10 to 15 years when you have the infection.
So at least you've touched on the predispositions. Is there anything got to do with genetics as well? Now that I'm learning that it's sexually transmitted.
When it comes to cervical cancer, genetics don't really play too much of a role.
So you cannot say that because your mother died.
For cancers, there are still studies every time. Once someone very close to you has certain types of cancers, definitely your lifetime risk, there's some small percentage there. Yeah, but when it comes to cervical cancer, genetics don't play too much of a role. It's mostly with our HPV infection.
I mean, in the early years when we started talking about cervical cancers, we were learning and finding out that there have been some myths, and women who were living with cervical cancer in certain rural areas and all, you find out that people associated with spiritual, they say it's spiritual. Why? Because of the symptoms that the women that have it will show. So let's talk about the symptoms. How does it usually normally start in many women?
Okay, so probably the spiritual part may be the very bad, foul smelling, discharge. Oh, it is so bad. Like, it smells so bad because, I mean, these are dead cells, like cancerous cells down there. And from time to time, even when you have just a normal candida infection or you have you can imagine the smell. So if there is something happening down there, you can imagine how bad the smell is. So the few cases I've seen who had the discharge, it was. So you can just be close to the person and, the smell will not be too good. Probably that's what people would realize, maybe a smell around the person. Most of the times, again, once it's early, no symptoms. Like even at the very, very early stages, no symptoms. But then with time, people can complain about general pelvic pain. I mean, pain around your pelvic region. And then the other one is bleeding as well. Because once the cervix is at the tip of the vagina, for instance, after sex, due to contact and all, so postcoital bleeding.
Okay.
So bleeding after sex can be one common symptom, like those who have cervical cancer come in with. Then the other thing is postmenopausal bleeding. It's really significant. Like someone who is in the menopausal period, we are not expecting you to have any blood, and then all of a sudden you start seeing blood. One of the first things that will cross our mind is to be sure it's not cervical cancer. And then intermenstrual bleed. So in between your cycles, I'm not expecting to see any blood. So from one menstrual flow to the next, then all of a sudden in between, that one doesn't necessarily mean it's cervical cancer, but then it increases, yeah.
And so the blood that you see, which is not supposed to be your menses or your period, is the color the same? Does it have any different look that should get a woman alarmed?
So it will be difficult to say. It might actually just look like your menstrual flow. It can be altered blood. It can look not necessarily blood, like darkish, brownish. It's really varies.
Okay.
Yeah. And then the other thing with symptoms is, I mean, once we mentioned that it starts at the cervix and then progresses to other parts, of course, if it attacks your bladder, then you'll probably present with some urinary symptoms, maybe frequency, maybe pain with urination. So as part of the investigations, your bladder really has to be checked to make sure that there's no like cancer cells there as well. Okay. And then even your rectum as well, where the feces come out through. You have to check that because once the cancer cells are there, you can come up with so many other symptoms.
So at what stage do women present with a foul smell?
Some of the things, it's really case dependent. That can probably be the very first symptom the person would see. For another person, the bleeding might be the first thing to see. So it's really difficult to tell that this is the point at which you would see the foul smell.
Okay. Does age play any role? Does it present any risk factor? What age should a woman be very well aware and start screening and all of that, which is what we'll go to?
So cervical cancer over the years has shown an interesting pattern when it comes to age. In the past, we would have probably said it's something you should be worried about when you're probably more than 50 years, getting to 60 and all that. But then again, you'd have people 40s, maybe late 30s, presenting with some symptoms, or especially with the precancerous lesion. So no one is really exempted, but when it comes to screenings, we would push for people above 30 years, for the general population above 30 years, to actively start your screenings. However, if probably you have a co-infection like HIV, then the age at which you start your screening is earlier, about 25 years.
Okay.
And so generally, there are two main things that we'll be doing during the screening. You are doing your pap smears, and then you are doing your HPV DNA testing as well.
Right.
So now most of the things we are pushing for is the co-testing, where you are doing both. You don't do only the pap smear or only the HPV test. You do both.
Okay.
And if after 30 years you are doing both, you can repeat it within every 3 to 5 years. Every 3 to 5 years, you repeat it and make sure it's normal. Okay. After 50, 65, thereabout, if you've done about 2 or 3 and they are normal, you can have a discussion with your doctor and probably hold on to it for some time. Because if you've done it consistently, all these years and it's been normal, the possibility of we seeing any change later on is quite low.
Okay. Yeah. We'll get into the preventive measures, which will be the vaccines and all of that, the screening. But I mean, you have said that it's good news because at least you can prevent it. But can it be cured? I mean, you have just told us that it is in stages and all. But if it can be cured, at what stage? And at what stage can it not be cured?
So, of course, if it's early, stage 1, stage 2, it's most of the times it can be cured. Once you get to your stage 4, then you're talking about palliation. Because now we've lost a hold of it, if I should say, where it's left the pelvic region and it's gone to all the other organs in the system. So in that case, palliation becomes what we talk about, trying to make you comfortable as much as possible till the ultimate happens. Yes, but for the early stage cervical cancer, there's so many things can be done. from surgery. And when it comes to surgery, there are a number of things depending on how far it has gone, whether you are just taking the cervix off or you are taking the cervix with probably parts of the vagina or the whole uterus. So there are a lot of surgical interventions that can be done to help. And if it's very, very early, that alone should be good cure for you. Then once it starts leaving the cervix to other structures, then you can think about radiation. Radiation is when we are using beams to hit the cells. And then we can think about chemotherapy as well, like we do for most other cancers. And then immunotherapy. With immunotherapy, we're giving you certain medications to increase your immune system so that you can also fight the disease. Then there are some targeted therapies. So depending on the stage, about 1 or 2 of these treatment modalities will be put together for you to help. Yeah.
What's the survival rate?
So
would also depend on the stage.
Exactly, it will depend on the stage. Once it's very early, if we are talking about cure, then the survival rate, of course, maybe like a 9 out of 10.
What I'm learning from you now is all the answers is pushing me back to screening.
Of course.
Pushes me back to screening.
Yeah.
Okay, then let's get into it. So how can we prevent it?
Okay. So when it comes to prevention, then, I mean, based on our discussion so far, we mentioned the HPV vaccine. I mean, any woman who is watching us today, if you've not, first of all, screened or you've not had your vaccine, you should go look for it. As of last year, WHO announced about 6 different vaccines. I know in Ghana we had 2, but currently the main one we have here is the Gardasil. So Gardasil is available here. There is Gardasil 9 and then Gardasil 4. So 9 meaning that it helps or prevents 9 strains of the HPV infection. So remember, 16 and 18 is causing your cervical cancer. Okay. So your Gardasil vaccine is preventing
16 and 18
for cervical cancer.
Plus 7 other.
Exactly. Okay. So even the ones causing genital warts, the vaccine also helps with it. Okay. So especially with the 9, helps with several infections and several cancers, not just the cervical cancer. And that's why we are pushing a lot of people to go for.
Let's stay on the Gardasil. So it is a brand.
Yeah.
Okay. And so you say it is either, so there's 2 types of the Gardasil, which is Gardasil.
A 9 and a 4.
A 9 and a 4. And the 9 and the 4 is what prevents you, or which one of the 2 prevents you against? So the 9 prevents you against 9.
So the 9 prevents you against 9 HPV strains.
Okay, and then the 4?
4 HPV strains.
Okay.
So
is it just 1 shot?
So generally it's 3 shots.
Okay.
3 shots. So at least 0, 2 months, 6 months you have it. But the last one can be had 6 months to 12 months. Okay. However, because of the cost, some people are just taking 1 shot. Okay. Some studies have shown that even 1 shot goes a long way to help. But if you want to get the full thing, 3 shots are recommended. Currently, even in government facilities, just a shot is about 2,500 cedis.
Yes.
It's very expensive.
It is.
And that is the reason why I think this is still a big issue, because even normal day, people are struggling to make ends meet, to feed themselves, and now you want them to use 2,500 cedis to go for 1 shot of HPV vaccine.
And they will need about 3
yes.
if they really want to prevent it. Okay.
Yeah.
Is it just in Ghana that you need about 3 shots? Because I've been learning in other parts of the country that when they see your age, there's a Gardasil that when you take 1 per your age, then they say it's okay. If you're younger,
yeah.
Okay.
So that's what I'm saying there. Like especially during the COVID period, a lot of studies were done where sometimes depending on your age or immune system and all, just 1 shot is okay for you. Okay. Sometimes 2 shots at most is fine. However, if you probably are a little immunocompromised or there are any other factors that we should be worried about, we will not want to risk it. We will not want to do a 1 or a 2. We'll still go for the 3. Okay. So for the general population, 3 is the standard. But depending on what is peculiar to you, you can have discussions with your doctor and see if 2 will be okay for you or even 1.
Okay, so far for the vaccines, that's what we have available in Ghana. What about children?
So ideally, the best time to take the vaccine is when you've not started sexual activity.
Okay.
So most of the times, we're even pushing for people to start 9 years. So 9 to 15, that's the like brilliant gap. If we are vaccinating, for instance, if we had a policy here where we're vaccinating all our, young girls, 9 to 15, you can imagine the outcome in several years to come. We'll not be seeing all these deaths that we are recording now.
Okay.
So that's really the best time to take all the vaccines. That's really the best time.
And so if I understand, by the time you're taking the vaccine, you may have screened, you may have done your HPV DNA.
Yeah.
And then you may have done your pap smear.
It's not May, you should. You should.
I'm hoping that you know that, but I say you're taking your vaccine.
Should, yeah.
And between the time you do the screening, how long do you have to stay to want to take the vaccine?
The vaccine. Okay, so I think the screening, when you do the screening, it takes about maybe like 4 weeks plus, and then the results come. Once we have the results and it's fine, then of course you can go ahead and take the vaccine.
For somebody who is not able to afford the vaccine and is taking to screening and all of that, how long intermittently can you have your pap smear test? And how long can you also do the DNA, the HPV DNA? And these two are done together, right? What's the difference?
So the same sample that we're taking. So you know how the pap smear is done. I mean, you come, we talk to you, you lie down, the legs raised on a stirrup, and then the down area is cleaned. We open with a speculum, take some cells from the cervix, and then it's sent to the lab to confirm. The same sample used when we take the pap smear, that's the same sample used for the HPV DNA testing. And that's why we're even encouraging people as much as possible to do the co-testing. If you are just staying with only the pap smear, probably due to cost, then at least every 3 years, all things being equal, if you are okay, or every 3 years should be fine. If you do the co-testing, where you are doing your pap smear and the HPV DNA testing, up to about 5 years, even WHO will sometimes push it to 10 years, because then we are sure that at least we've done the two and everything looks fine there. Yeah.
What is a pap smear looking for? That's the HPV DNA. What would the HPV DNA be looking for that a pap smear couldn't find?
So HPV DNA, so that's your HPV, the virus, and we are saying the DNA. So it's confirming for us if you have the HPV infection and also tell us the particular strain you have. For instance, if you do the HPV DNA testing and it's like you're positive and then probably a 16 or 18, we know most likely the possibility of you getting cervical cancer in a few more years is high. Then the pap smear is telling us changes in the cells in the cervix.
Okay.
So if you do the HPV, it's positive, and we're already seeing some changes in the cells, then we can most likely, say that we need to quickly intervene before, you progress to cervical cancer. So the pap smear is focusing on just the changes in the cells.
Okay.
And then the HPV is helping us confirm the strains of the virus.
So it's really not enough just to do the pap smear?
No, it's not.
Okay.
It's not, but if you can do only the pap smear, it's better than nothing.
Okay.
Yeah.
But if you're certain you want to take the vaccine, it's not enough to just do the pap smear.
Yes, we need to do the HPV before.
Okay, to be sure that you don't have it, because we can't prevent it if you have the virus anyway.
Exactly.
That's the whole point.
Yeah.
Is there anything like self-testing?
Yes. So there are nice tools, or should I say tools, self-testing. Yeah, there are kits that can be done. I know Sheba has one. Yeah, you can actually just do it at home, and then you send them what you've taken, and then they work on it and send you the results. And I'm sure that will probably be even more expensive. I'm not sure of the cost, yes, but self-testing is.
I was going to ask that the vaccine, with the price, the cost of it, God, and so at least the screening, is it affordable anywhere in the government facilities or anything? Which one would you at least encourage people to start with at least?
Okay.
Which one is affordable?
So aside we pushing for the pap smears and then the HPV, especially for low to middle income countries like ours, and there's also the VIA that sometimes is done, which is not really ideal, but it's at least it's better than nothing. So that's the visual inspection with acetic acid. So you just look at the cervix, and then we apply something then. So if there are any changes, you can see. And that one is even just 50 cedis in the most government facilities. And some of my colleagues were telling me that even with that one, people are not able to afford. Your pap smears generally should be around 150 cedis, 200, maybe like you can stretch it to about 500 in some facilities.
In government hospitals, it's quite
It's
lower
quite,
than in
yeah,
the
it's
private
lower than,
facilities.
yeah. And then your HPV DNA testing, probably a 300 plus. You know, so if you're doing the core testing, probably like a 450 plus. And that's
Something.
it's something.
I mean, I'm just concerned about the vaccine, as you also have. And so, in the conversation around cervical cancer, both from the screening to the vaccine and all of them, nothing about it has been migrated onto the NHIS. The NHIS covers absolutely.
No, as it stands now, I don't think so.
When I said Dr. Bakman, mo kasa, bobe kasache. Anna.
So you see, that's one of the heartbreaking things. Even with the vaccine,
Yeah.
like now it's not readily available like that. Like over bre and sana, you get it, and then
Yes.
even if you get to see the cost, so
Yes.
like we do all these awareness creation, and then at the end of the day, the reality on the ground is not going to help with the outcome that
The vaccine shot is quite painful. I took my
Oh, you
vaccine a
did?
year ago.
Oh.
And the bomb.
Oh,
Still
really?
It's still painful. Is it just
How
me,
many
Anna?
years?
It's almost a year.
Oh,
It's
where
true,
they are
Dr.
check.
But you been saying now.
Oh, where they are check.
Is it that? Is it the
Where they are
vaccine
check.
and a society and a
No.
pioneer biana?
Oh, but when you go, generally you go take vaccines, you know, those initial reactions and all, but for a year, dear, then we should look at it.
It's true.
It's too much.
I mean, we're trying to have a conversation on a lighter note so that you can take the decision yourself, because we did a little documentary about a woman who had cervical cancer in the end stage and she didn't know, because when it started, they kept, associating it to spiritual matters, her family members. Of course, for a woman, if
Yeah.
so it's not just a smell. You also discharge. Do you discharge?
Yeah.
Okay.
So it's a discharge that most of the times,
This is
know,
the smell. And when she sits down and she enters a room, you can't breathe. When you get up, the chair is wet and all of that. And for some reason, nobody in the family could even think that it could be cervical cancer until NGO took up that case and wanted to investigate it, and we found out that.
But why she wasn't going to any health?
No, because in some communities that they don't even
That's
think
true.
about
Yeah.
it. They don't
Yeah.
even think
Yeah.
about it. And even if they did, you'd have to be lucky to meet doctors like Dr. Bachman who have actually you've taken the matter into your hands and you want to look into it. So when a person presents with a certain symptoms, you want to go beyond further what they. And so the conversation is, but it's expensive.
It is.
Apart from it being expensive, the pap smear kits and all of that, are they available?
As for pap smears, yeah,
They're available.
most government facilities should have it. It's very available. It's very available.
What kind of cervical cancer services can we get at Sonotech?
Okay, so Sonotech, of course, we do the pap smears, we do the HPV DNA testing as well, and then we have the vaccines. We have the vaccine as well, but
you import the vaccine.
we
So
have
I
it
checked,
as
it
well,
was
so we
$200 and
can-
something dollars per shot.
It's expensive. It's expensive. Yeah, yeah. So, I mean, as you earlier on said, I think we cannot continue this discussion without government and other, other organizations really joining force. Because as we've, discussed, cervical cancer is one of the cancers that really shouldn't kill our women. If we are investing in it well, why can't we have like a national something with the HPV vaccine, where all our girls, like 9+, you know that it's a routine. You're a Ghanaian here, you're 9. It's almost automatic for you to get your HPV vaccine. That would be really brilliant. I'm sure we'll get there. Yeah,
hopefully
I'm sure
we'll
get there.
lose a lot of lives before we get there.
Yeah.
But let me say thank you to you. And so we can find Dr. Grace Bachman at Sonotech Medical Center, and you can get screened. The vaccines are also available. It's not just cervical cancer. At least January, we are talking about it. We'll move to next month, and maybe we won't be talking about it again, but it still exists. And so please, once in a while, dash to her, get screened. At least your well-being. I've been talking about it. Care about yourself for a second. So let me just take your last words.
Okay, so I think ultimately you're responsible for your life. To all the women watching us, please get screened. Make sure you take on responsible sexual practices so that you don't get infected with the HPV. And we can definitely win the fight against cervical cancer together.
Thank you so much. You're doing amazing with the messages that you churn out and all of that. Please don't stop. Thank you for talking to us.
Thank you.
I hope I don't try any atom world so that I come to you so that you. I'll try
The messages are a lot. Oh, even yesterday, I mean, every day someone is doing a different atom. And I'm like, it's too much.
Anyway, pleasure talking to you. Guys, let's plug you onto a graffiti artist to stay.